afternoon, everybody, and welcome to Zon Academy. Today, I have with me Phil Marianacci, who's the owner of 360 Digilab, and he's going to be discussing with us the virtual collaboration between the dental clinic and the dental laboratory, featuring the software Nemostudio, brought to you by Nemotec. And so, today, Phil has decided to bring us some poll questions that we're going to be launching like right now. So if you wouldn't mind, when I put them up, to please answer. I'm going to give you about 30 seconds for each, while Phil, goes into just a little bit about himself. But we also will be having a live Q&A, and that's going to be happening at the end of his presentation. So if you have any questions, which I know you will, please type them in to the bottom of your screen at the Q&A section. Phil, I'm going to turn this over to you, and I'm going to launch our first question.
Awesome. So thanks for having me on, Fran, and thanks for being on, everybody. So I'll put my screen up in a moment here. So while you're kind of filling out some of those questions, one of the purposes of why I'm here is we are kind of in this zone right now where we're looking for ways to integrate, collaborate, and as one of the questions on here is we have some dental lab offices and technicians on here, and we also have some dentists that will most likely be on here. And at the end of the day, we're partnering, and we're looking for ways. If you're a specialist on a dental clinic and you're a specialist, you might have a referral network and you want to be able to collaborate. If you are a dental laboratory, you're looking to collaborate and create value for clinics and general dentists. And what this Nemostudios, and we'll get into more of it in a moment after you answer some of these questions, is it's a collaboration tool, not just making surgical guides. And it's an easy, efficient way to communicate. And there's a lot of functions that it has along the way, but that's how I view it. And it has its most value is that it's integrating all these things into one. And that way you don't have to kind of jump off and go into other softwares back and forth. And we know that we have to do it a little bit anyways. It's more of narrowing things down and being able to utilize it. Fran, are we done with those questions, or?
We are. We just finished with the questions. So right now, we have 100% of our attendees that are lab technicians.
Okay.
Didn't see any doctors answer. 25% are using implant software at this time, and 75% are not using any implant planning software right now.
Awesome.
And we have a 50-50 split on the cases per month. 0 to 10, 50%, 10 to 20, 50%.
Awesome.
That's who you have here, Phil.
So so that helps. This is going to be very casual. So this helps to kind of go kind of geared a little bit more towards you all that are on here. So and I'll kind of share a little bit more of, even though some of the dentists are not on here, I know many of them reached out to me yesterday, and they're going to be watching this. So I'll have kind of things on there for them as well. So
yeah, and this is definitely recorded, everybody. So I know this will be a lot of information. You'll be getting that in your email, whether you registered, watched, or not. So you'll be able to go back and see Phil's presentation. But everybody, enjoy this presentation, and I'll see you at the end.
Awesome. Fran, does everything look good though, like on here? You can see the screen?
Awesome. Everything looks great.
Awesome. Perfect. Thank you.
Thank you.
All right. Again, so thanks for being on here. Before I get into a little bit of background on me, I wanted to talk a little bit more of the introduction of Nemo and why this is. So why the collaboration is essential, and it's really achieving seamless collaboration between the clinics and the dental labs is very crucial. I'd say it has to be. In the coming years here, that's what people are going to value. their time. And by utilizing this, and you'll see it in a moment, it will allow you to be more efficient with your time and more of a collaboration. So as a lab, and you'll get to know me a little bit here, my background, but as a laboratory, there's a lot of gaps of communication and delays and inconsistencies, errors that go along the way with it. And ultimately, we do the best that we can with QCing, but things can get missed. And so the more that we have things all in one place makes my life a lot easier, and all of ours. So some of the challenges in the dental lab clinic, and you can relay this to most of all the people here are lab technicians, is really having like more of a real-time communication that can be instant and not being phone calls or text messages or things that get missed. You have one technician that is taking a text message and it doesn't get recorded. The information doesn't, they're on vacation and it's not all in one place. There's a higher chance of having errors. And so, uh, you know, between having like physical model shipments and the delays in there, the doctors can put the information in instant. And sometimes we can, let's say it is a traditional case, we can start working on things. We can get ready for things while that shipment is being shipped. So reducing errors, super important as a dental lab owner or a technician. And so you might be thinking like, what is Nemo Studios? Is it just implant planning software? Or is it have other functions that entice the doctors to get it? And then therefore we want to integrate and, make guides and communicate. And that's essentially what it is, and a whole lot more, but that's essentially what it is at its core. And so real-time case sharing, immediate access to digital scans, designs and treatment plans, enhanced communication tools, seamless case approvals. That's a thing that sometimes we wait on by phone calls back and forth. And process standardization. As you grow as your lab, the easier way to grow is to standardize the process. And so it reduces error, saves times, and it helps with those complex cases. So, like I said, I don't think it's kinda we got to start going towards this way. I think it's really essential to adapt to in integrating software, having a lot of tools all in one place is or as many as we can is really crucial now, and I know it will be for the future as well. So a little bit of the background on myself, which is Phil Marianacci here. So we started the lab essentially back in late 2018. And me and the other owner, Josh Wools, we were essentially salespeople, and we were looking to sell scanners and equipment into dental offices. And we seen that kind of what was going on, where there was a decent amount of outsourcing, and then a lot of nice mom and pop shops that were having a little difficult time to adapting. And so what we thought is if we don't do outsourcing, we do the work in-house, could we make a nice lab that we could be proud of. And I guess we were naive enough to go into this crazy business that we were in. And so I'm really happy that we did. We've learned a tremendous amount. But the first really 2 years that we were doing research and development, and we were buying the equipment that we could afford, and we started looking to see how we can make things easier. And we were talking about workflows that were streamlined and kind of an all-encompass kind of software, which doesn't exactly exist in everything that we do, but how do we narrow things down? Because we were really technology people too. And so we started kind of reaching out to study clubs and seeing what they were doing. And I met Dr. Brian O'Neill, which we'll be talking here in a moment. And he was he's an oral surgeon. And he started right around that time, he started using Nemo Studios. And I kind of seen what was going on, and I go, do you utilize this to talk to doctors, other doctors in your referral network? And he's like, yeah, I just started doing it. And I seen his excitement, like, well, this I can do some easy peasy mock-up stuff, and I can share it with them and then group you into it. And I'm like, yeah, let's do that. I was trying to grow my lab, especially in the very beginning. I was really trying to grow my lab because every office was super crucial for my foundation. And so I started seeing how it was working, and we could collaborate, and we didn't have to work on the restraints of, we had some doctors that would kind of respond to things like 8 o'clock at night, or 6 o'clock in the morning, and we would be missing each other. And it was the only time that we could do it. And, you have the whole family time and everything like that. And getting multiple people all at the same time is nearly impossible. So we started using Nemo Studios to really collaborate and talk, and having it all in one place. I could throw in designs or mock up things, or the oral surgeon would put in mock-ups, and we would all share things together. And we didn't have to do, we could do it throughout the day. You had all day to do it and put it in there and say what you wanted to have happen. And sometimes it's an easy, just, yes, please proceed, or uh, hey, I'd like a little bit like this, and it's all in one place everybody can see, and we don't have to share emails or we transfer and everything. So that was right around the 2000, right after COVID. We started really started trying to get doctors to come on board with us, and utilize the tool because we've seen the value that it really brought. So just to give you a little bit of background on that part of it. Also along that way, though, we bought a few labs and brought them on. Great people. In fact, just about all the owners are still with us on board now. And so we ran out of space. Fast forward, we have 75 people right now, inching towards 80 people. And we did it with a short period of time. And we don't have salespeople or anything like that in on board, but what we do is we utilize things that attract our clients, which is our dentists, that we're trying to bring value. And so this this is one of the pieces that communication is what I value, and it seemed like the doctors valued it, and it worked. And so this is one thing that you can do that will allow you to potentially, work with more, reach out to more doctors and provide value. And so, um, so um, along the way, we bought, better, robust equipment, and so that um, we can work efficiently and have things mill overnight, and sometimes print overnight, and along the way, we just kind of adapted that type of technology and robust machines that we could afford. Okay. So what am I looking to do in the future? I'm looking for integrate things that will attract doctors' value. It's as simple as that. I mean, it might be communication, which is huge, right? Um, Being able to teach and educate. We're going to be doing more of those things that will help attract and partner with our clients. So that's essentially what our core and what we're looking to do. A little bit about Dr. Brian O'Neill. He's over in the Toledo, Ohio market area. He's the owner of Harbor Light Maxillofacial. He's been a board certified oral surgeon since 2000, and he is one of the big Seattle study clubs over in Ohio that has about 80 members. So the people that are lab technicians or owners on the call, I highly recommend getting more involved in study clubs. That 80 doctor study club was, man, that really helped us with our foundation from the beginning and even now. And it really creates really great partnerships, and I highly recommend it, doing it for you all out there. Plus, you learn a lot along the way. So Dr. Brian O'Neill, again, turned me on to the Nemo Studios, and he does a good amount of guided implant surgery, and he does incorporate digital smile design, DSD workflows into the practice as well. So Dr. Brian O'Neill, he's going to begin showing you, but I'm just going to give you a brief overview of what that digital workflow looks like for the Nemo Studios. And it is a cloud-based platform, which I love, and it is showing the case management and between the lab and the clinic. And it does the diagnosis and analysis, planning, communication, design, production, and valuation. So first, we're going to get into a little bit of the Nemo scan and what that looks like. And so it is implant planning guided surgery for, and you can do immediate load prosthesis. And we'll show it in action in a moment. But what that does is it really improves the quality and speed of the treatment planning. It has a lot of AI features in there that let you do the segmentation and anatomic structures. And it allows you, clearly you can see with the dental nerve and teeth, gives you better visualization for layout for the planning purposes. So you can incorporate AI photos, alignment. You can take out, open up for the lip, and it just speeds up the process of it. So we'll talk a little bit about for guides, drill guides, cases where anatomical surgical kit conditions allow to fully guide and implant drilling as an option. So the implant guides placing through guide, obviously we believe it's a really accurate way to obtaining the surgery for planning purposes. And lastly, the Stackola guides. And you can see here in the photos, and then you'll see it in a moment in action. So a little bit about just the background on the Nemo Smile. It's really showing the function and facial harmony. It's got the concepts of the Christian Coachman, who Dr. Brian O'Neill works closely with too as well for so if you don't know what it is, it's software more for digital smile design planning center, and it will help with facially driven superimposing measurements, teeth analysis for ideal the curvatures, and following the lips for the patient, and 3D integration for teeth, bone, soft tissues, and 3D scenery. So what this does, the Nemo Smile, it helps for treatment pull through at the office. And so what we highly recommend is, every clinic, if they're general or specialist, is having treatment coordinators. We really believe in that, and having dedicated. So basically, the doctors are not having all the financial questions. They can get them really excited about the smile design, and the staff can talk about the financial arrangements and options of what the dentist believes is the best possible option that's out there. So, and that helps. What you can do is you can have the mock-ups pre-treatment and then the post-treatment, so that they can really kind of see the what things are going to look like, and what are some possibilities. So what I see Dr. Brian O'Neill using too is he does that for crown lengthening, prep guides, and what we just showed a second ago. What I was showing was the mock-ups, the different types of mock-ups. So this is something that I don't claim to be. Ortho is not my side of things, so don't claim to be an expert in this by any means whatsoever. But it does have orthodontic treatment planning, and that you can do aligners, you can do airways options, and we do have a few of our orthodontists that are part of a couple different study clubs. They are using this functions into the group. So sometimes if we're planning a case and it's a all on X case, and we may be doing a max all on case, but we want to do some ortho treatment on the lower, right, on the mand. So we group in the orthodontist in here, and they will give some options, and it works really beautifully that way. And as you can imagine, it's really hard getting everybody all on the same page, or getting information all on there. And when it's all in one place, you can make better decisions, which is beautiful. And that's just my perspective on it. But the orthodontists do use this for multiple different things orthodontically. As you can see here, setup, staging, mini screw planning, and as simple as like aligners, indirect bonding, and this goes along with that as well, which is it's not just splints and things like that. It's more of more in depth on different surgery related. So working with ortho and working with oral surgeon, this side of it works beautifully. As you can see here, some custom plates. Awesome. So the key things really is it's kind of broke down by 7 steps, and it's records, storage, which cloud, like I mentioned earlier, the cloud, I love having cloud storage, analysis, planning, design, manufacture, and evaluation. And what that does is time is really important. I only have X amount of time. I'm only one person. And so I love having software that allows have that things can be done. We got a couple doctors that they actually wake up really early in the morning at like 4 in the morning, 4 a.m. I'm not doing that. I have 4 young kids, so not happening. And that's how he likes to work and start his day. He can do that. And I can wake up, or our people can wake up when they wake up normally, normal people, I call it. And they can work on it when those approvals or other communications on there, and then we can work from there. And everybody can work in harmony with their time and how their schedule is. Get just a little bit more about the cloud-based. And ultimately enhance communication. I see how important this piece is more and more each day, and where we can get accurate information and not assume things. You know, we can not just assume and visualize, like we can put things and have facts. It just really reduces errors and misunderstandings, and it's very clear to everybody. I love having that, because then we can work with facts and not kind of assumptions. And I'm going to stop share this, and then I'm going to let share one more time. And Fran, tell me if this is not working.
Right now, I don't see it. I just see the opening of Dr. Brian O'Neill, but I
Okay.
don't see the video yet.
Okay, give me one more second here.
Hello, my name is Brian O'Neill, and I'm an oral and maxillofacial surgeon in Toledo, Ohio. I've been working with the Nemo suite package
Fran, you can hear?
software since about 2017, and I can tell
All
you that
good.
it has all of the solutions in a single digital, open, and interdisciplinary platform to allow you complete control of multidisciplinary cases for diagnosis, planning, and also 3D design. So I'd like to kind of take you through some of the ways that I use this tool. Again, it's not inclusive of all the functionalities of Nemo, but I hope to give you a bit of an insight and taste in why you should consider incorporating this into your clinical practice. So we're going to have a look at some of the features within the Nemo environment. Nemo set up that when you open up the user interface, you'll create an instance for a patient, and within that desktop view, you can have images that are two-dimensional, other three-dimensional renderings, whether a CBCT, DICOM, or STL files from an intraoral scanner. PDF files are also supported, so these things can all be archived within the user interface, and they can be built along a specific timeline. So we're going to look at some of the capabilities. When we click on Add Records, you'll see that Nemo gives us a couple of different apps to be able to choose from depending on the workflow that we're looking to engage in. You'll see that we've got Nemo Smile 3D, Nemo Cast, which is the orthodontic modules, Nemo Scan is the implant module, and Fab is the orthodontic surgery module. So it is a very robust suite of software applications that gives you the tools to be able to accomplish total control of your treatment plan. First and foremost, any treatment plan begins or should begin with the face. This is well established in dentistry from both Frank Spear and facially driven treatment planning, as well as digital smile design, Christian Coachman and Florin Kofar. You'll see that we have two different offerings for a starting point for smile design. One is STLs only, the other is STLs and DICOM. Interesting things within restorative dentistry is to incorporate tooth root position to determine feasibility of prep lines, and also to see if additional orthodontic optimizations helpful for either implant placement or to try to work with minimally invasive restorative dentistry. So we're going to click on Nemo Smile 3D as our starting point, and it will bring up an upload category. So we'll go ahead and first bring in the DICOM from the CBCT. It's a pretty straightforward wizard. We'll go then and also bring in our STL files. These just happen to be STL files from a trio scan. And then the cool thing and time-saving thing is this auto-segmentation tool. So if we activate this, we can go ahead and we can start to then utilize things like isolate the bony maxilla. We can look at the sinuses, and we can look at the crowns of teeth. We'll go ahead and hit accept, and we'll go ahead and upload this to the cloud. The turnaround time on the auto segmentation ranges between 5 and 6 minutes. It really does depend on your internet connection. You can monitor the progression with the status bar over here. So Nemo's completed the cleanup. We could see that we're 100%. And then we have a rendering. We'll go ahead and reload the records. We'll go ahead and open that. So now we have the maxillary case. Now, if I go ahead and off the maxillary bone, you can see these cloud-like structures back in here. And what these represent are the maxillary sinus volumes bilaterally. So this can be helpful in terms of determining the extent of pneumatization of the maxillary sinus. And if you're planning for implants, it can kind of gives you a sense of the extent into the surgical realm, whether or not you're going to need sinus augmentation, etc. But we'll go ahead and turn those off for the time being. And then we can also turn off the gingival mask, and you'll see what we've done is we've separated the tooth roots, the crowns, that is. Notice how it doesn't incorporate the tooth roots. That's by design. Nemo will provide us with the tooth roots, but for the purposes of our treatment plan, I'm going to show you how this can be advantageous. So we'll go ahead and we'll turn these meshes back on. So now what we'll do is we're going to do facially driven treatment planning. We'll go to our photo library, and what we're going to do is point alignment between the photograph and the STL file. So we're going to mark some common points between the two. Do an alignment, and then we can verify the alignment by basically toggling the transparency, and we can position the STL in position relative to the patient's photograph. Well, now we have some decision making to make in terms of treatment planning. This patient, by history, had some grafting done. There was some infection that happened and some corresponding bone loss. You can see some soft tissue retraction along the distal aspect of tooth number 8. There's mobility with it as well. She has a similar issue happening with tooth number 4. So our tentative treatment plan was going to be to include the extraction of teeth numbers 4 and 8, building into a plan. We're planning on an implant-supported fixed bridge. Given the tremendous volume loss in here, we have to make a decision about whether we should try to augment this surgically or if we should just build it into the design with a hybrid type prosthesis incorporating pink anatomy. And this is how we elected to proceed. Then what we have to do is we have to say, okay, well, what tooth shapes are we going to use? And many people work with tooth libraries that are provided by various design softwares. But nowadays, one of the big pushes is to utilize natural algorithms. This was first discussed with Paulo Cano over in Brazil, and Florin Kafar has really elevated this to the forefront of modern dentistry. And you can see in her situation, the tooth shapes themselves are rather good, right? These are not heavily restored teeth. They're intact dentition. Of course, she's got some gingival retraction, but the morphology of the teeth is something that we can utilize. So Javier Vasquez is a master technician and prosthetist in the Miami area. He did a very nice collaboration with Nemotec to create a smile emulation module. And basically what that allows us to now do is to copy the patient's anatomy very easy and to create custom libraries. So if we go through the process, we're going to use this particular case. We're going to call it 1MB. And the teeth that were segmented as part of the auto segmentation are indicated here in this bluish purple. Teeth that are missing, you can see where they're absent. So what we're going to do is we're going to want to copy the tooth number 4 shape morphology, tooth number 8, but then we need to fill in numbers 7, 6, and 5. So we're going to basically copy number 10, 11, and 12. Nemo is going to do this when we collect or indicate symmetric and add teeth. It'll create basically a custom library for us, mirror images, if you will, of the opposite side. And it presents it as, say, a denture, card teeth for a denture. So now we have a library to be able to work with. And we can start to now think in terms of prosthetic design. Before we can go there, we do have to think about some extractions. We're going to simulate that virtually by selecting the upper model. And then within the software, we're going to extract virtually tooth number 4 and tooth number 8. You can see how that's then reflected down here in the STL file. It closes the mesh and simulates extractions in these positions. And then what we need to do is to create a new STL file based on that extraction protocol. So we're going to go to click Superior, and it will render this nice model for us that could be printable and will serve as the basis for our implant planning. The colors sometimes can be difficult to discern. Again, we don't need to concern ourselves with the lower tooth position at this point in time. So we'll go ahead and hide those for the time being. And the other thing too is the color of the mesh. Sometimes we can enhance that, make it easier to visualize. Just choose a different color, and you can see now we've got something that's easy to see. And we're going to begin our prosthetic design. Again, we can go back and we can confirm the position of the STL file, within the facial photograph. When we're planning the prosthesis, we do have to do a couple of things. First thing we have to do is we have to indicate an arch form for the patient. Nemo will give this as a tapered form, the little green line here. This is fully editable. It just helps Nemo determine where we want the occlusal plane to be, and then we're going to lock that to fixate it. Now it enables us to go ahead and to add a prosthesis. So we're going to go to our smile emulations. We're going to go to 1MB, and we're going to select the teeth that we're looking to replace, and we're going to add those. So these are the previously created custom library based on the patient's actual morphology. We're going to click OK, and then Nemo is going to place those STL files basically into the mesh. And just move these into a more appropriate position. We'll just start moving some of these little teeth, STLs, more or less into the space, just for some preliminary conversation and assessment. Again, one of the things that these things naturally start to make you then look at are some of the tooth rotations that exist on the opposite side. And also, I think there has to be some kind of acknowledgement or discussion about should those be corrected orthodontically, or are we just going to more or less keep things as is and just kind of fill in the space. And that's the multidisciplinary team aspect to it. I don't think there's any right or wrong, but the important thing I think is to at least have the conversation and to document it with the patient, so that it doesn't become a point of discussion after the fact. So we've got basically an initial arrangement. And what's nice about this too is it gives us a kind of a broader sense of the defect. Right now, I still have the STL of the pre-extraction model. We're going to go ahead and look at it in the context of the extraction model. You can see with the blue, it's a little bit easier to see. It also kind of gives us a truer sense of the volume deficit. And to me, trying to augment this with natural tissue, I don't think you'll be able to graft that to a point where you're going to get natural appearing papilla. They're typically going to be quite blunt. And in my opinion, incorporating that into artificial gingival design makes the most sense, especially in a high smile line case. We can also get a sense for how this now looks in the context of the patient's face. Again, we've got some reasonable symmetry. The other thing that's kind of nice to do, and Nemo gives you these several tools to be able to do this, is to basically take the natural side, the left side, and try to use it as a guide for the right side. The way we're going to do that is we're just going to go ahead and duplicate that, and we're going to call it a different color. So we're just going to call it green. So now we've got a duplicated mesh. And now what we're going to do is we're going to use some tools within Nemo that allow us then to copy one side and use it as a reference for the other side. This is kind of a slick thing to do. It's kind of helpful. Again, do you have to do it? The answer is no. But if you're doing a presentation, or if you're just so inclined, to me it makes it fun, more fun. And you can see very quickly we can start to change those contours. Okay. Then what we're going to do is we're going to create a mirror image of that. And then what we're able to do is within the software, we can take this green section and more or less use it to kind of get a sense for how things are. And you can see we're relatively close, just kind of a neat, fun little thing, tool-wise. Again, it may not be 100% precise just because of the opposing. But again, you can use this then to further fine-tune your tooth position. So we'll just go ahead and do a little bit of that here. I'm just going to take this cuspid maybe a little bit, bring it out, and tip it a tiny bit. And we've got this. And again, we're, from a surgeon standpoint, we're just trying to kind of get a sense for where we need to be. Many people would just go ahead and use a dental laboratory to do this portion of it for you. And now we've got kind of a sense or prosthetic guideline. So just to recap, what we've done is we've simulated the extractions of teeth numbers 8 and number 4. We've done more or less a virtual wax up using a custom library of the patient's natural teeth. We've tried to mirror image the arch form just from a customization standpoint using tools within Nemo. And now what we want to do is go on with the implant planning process. So we're going to go to the Nemo scan, implant planning. We have our prosthesis. And what we're going to do is we're going to go to our treatment plan. So within the treatment planning window, we're going to go ahead and just have it where it's implant centered. We're going to go ahead and select an area. We're going to work basically from the tooth number 4 position and propose an initial implant for that location. And again, we can go ahead and modify that. Nemo will give us more or less a default or generic appearing implant. It's where it doesn't really have any of the anatomy, three-dimensional, speaking of the actual physical implant yet. You're able to select from a robust armamentarium of different implant systems. And we're just doing some, just some initial implant placement considerations. So it kind of gives us a sense of where we want to be. Maybe if we're planning for something screw retained, we've got good emergence on the bicuspid. The cuspid, maybe we can move that just a tiny bit. And then also, even with the central, and we can just double check that we're still within the confines of bone within these positions. Here you can see we're outside the alveolus on the canine, so we're going to bring that within the alveolar confines. And we're going to go ahead and just angle ourselves. And to maintain that cingulum emergence profile. You can see over here, Nemo gives us a generic version of an implant. We'll just go ahead and, for sake of conversation, we'll select some Straumann's. It's going to be a guided delivery and placement. And we're going to apply that to the entire case. Within here, we have the canine presently selected. So what we can do is we can go ahead and select out an implant for the corresponding position, and you'll see the generic form of the implant change to an actual three-dimensional form of the implant. And then we're going to do that in each of the positions. So again, we're going to go to Straumann, and we'll go ahead and select an implant. And then lastly, we're going to go to the number 4 position and select, once again, a implant for that position as well. And again, 2 of these will be immediate placement with extractions. One will be in a healed site. Next thing we have to do with, in terms of prepping for the surgical guide, is we need to make sure that we don't have any interferences with the underlying soft tissue. So what I'm going to do is I'm going to turn off the green mask here and also deselect the prosthetic teeth that we have, and that allows us then to see the actual guide sleeves on the projected model. What we can do is we can make it so that they don't interfere quite as much. We could just raise the guide sleeve in each position so that it's more or less above the tissue level. Depending on how you're approaching this case, some minor interference is not a problem if you're creating a flap. So now we've got our guide sleeves, and we've got our implant position, and we've related that to the mask, the prosthetic mask. Then what we have to do is we have to move on to the actual surgical guide design. So we're going to move to the products, surgical guide, and we're going to from a model. Nemo's going to make us choose which mesh we want to adapt the guide to or design the guide to. So we're going to use our extraction model. And it's that some of these guide sleeves are close to tissue, but from my standpoint, I'm going to modify that tissue at surgery. So we're going to essentially make it fit. Now we're looking at an insertion pathway, and we're going to use the camera direction to indicate that. And you can see the arrow over here kind of indicating that path of insertion. We'll click next. And then what we're going to do is we're going to design surgical guide. So I'm just drawing a spline line for where we want that to go. This is just operator dependent. I do like to get a lot of soft tissue support, particularly on the palate when I'm doing a large span edentulous case. And what we're going to do is we're going to then generate a guide. And you can see that Nemo basically creates a surgical guide incorporating our guide sleeves into the plan. Lastly, at surgery, what we want to be able to do is ensure that this is properly seated. What I like to do is I just like to create a couple different viewing windows. We're going to use some tools to be able to visualize that a little bit better. Basically, we're just going to punch some holes. I mean, I just tend to use rectangles or squares, but you can do a circle, you can make a custom shape. Doesn't really matter. The thing that matters is that it's seated properly. So we're going to create these windows in places just to verify that. We can actually do one more little one right back over here. And you want to do it in a way that doesn't interfere with the strength of the surgical guide. You don't want to make it too thin where you have to worry about the thing breaking when you're trying to seat it into place. And then the final portion will be to export this to be able to print. So in this situation, we're going to take the surgical guide and export it as an STL file. We're going to send it to the desktop. And then Nemo will give us an STL file. Now we can open up in, say, Mesh Mixer to then be able to execute the plan that we had defined. So I hope that gives you a nice introduction to the robust software package that is Nemo. There are other tools that can be very helpful. If you look at these lower teeth, it allows us now to say, okay, well, maybe we should do some orthodontics. You have to take into account, the coupling, the function, and Nemo will give us the ability with the Nemo cast module to create even aligners if you want to, or to simulate an orthodontic setup. So here we've done an aligner simulation for the lower arch correction, and we're going to check the occlusion using the virtual articulator function, both with MIP and with protrusive and lateral intrusive type functions. So again, I hope you'll see that Nemo is a very unique software suite of different applications to give you complete total control of the case from all different vantages from planning purposes. And if you have any questions, be sure to talk out to Phil with 360 or to reach out to local Nemotec advisors, and they can kind of get you started or provide other in-office demos. Thank you very much for your time.
Okay, perfect. Give me 1 second here. So hopefully that was helpful in for the doctors that are going to be viewing this. And the way that this works, there's what I see that typically the way that it works, doctors are busy, and so they like to dabble in doing some of the things themselves, but a lot of times they run out of time, and it allows us to like I said, there's plenty to go around to collaborate and um, to do together. And Dr. Brian O'Neill, he gets very busy, and he can't. He does have a 3D printer, but he doesn't always. Typically, he doesn't have all the time to doing that. So we do sharing of either printing or planning, partial planning, and of these large cases. So together. So what what we view things of kind of, is this here now, or is this do we want to do something like this now? Do we want to start doing surgical guides? Because I know a lot of you that are on here, you're not doing a ton yet of surgical guides. I would say get yourself get yourself trained, comfortable, because this is a great way to build your business. Um, in bringing this type of education to local study clubs, and really build up your lab, because it works. This communication, doing surgical guides, which then therefore, you're doing cases that are all on X cases. I This is what you want to sure up your lab doing these cases. I highly recommend it. So if you're looking a way to differentiate yourself and create value, you need these things for the future. And that ultimately concludes here. If anybody's got any questions or anything that I can answer for you, I'm happy to do it. Look, let me put my camera on. Sorry about that.
No, that's okay.
And
It's
I'm
pretty
here to
amazing
answer everything
software.
that I can possibly answer for you.
I mean, I'm sure there will be questions. Right now I have one,
Yeah,
and the first one is they want to know if there's any formal training because I mean, the software is pretty amazing and it's pretty robust. So, do you
yeah.
know anything about that, Phil?
Yeah. So I know with Nemotec, it is mandatory that you get training, and there's a lot of different ways of what you're looking, what type of functions that you're looking to do. If it's surgical guides, or if you're looking to do smile, or maybe you want to stage it. But absolutely, I would reach out to I'd reach out to Zahn, and I know that over at Nemotec, Lucia, and their group there, they're going to train you on all these things that you're going to need and so I'd oh, there's a contact form. Awesome.
Right, so that's what I was just gonna put up for you because, what's gonna happen is if you're interested in learning more about this and, what would happen is you would say yes to this question, and then I would give you a call, whether it be tomorrow or, late in the day, as soon as I get your information from the webinar, and we can discuss how to go about getting just a consultation to learn more and to learn about exactly, what you need to do to get this either into your clinic or into your dental laboratory. So,
I would
perfect.
highly recommend doing that, and learning more about what some functions can be for your type of laboratory, or if you're a dentist, I'd highly recommend, because collaborating with the different partners is key. It really is. So I highly recommend looking into this. It's a way to grow. No, it doesn't matter if you're a dental laboratory or if you're a dentist. This is a way to capture cases, and to build strong partnerships in communication.
Be able to, plan where the implants can be placed and
Mhm.
be able to, have your doctor really rely on you for that is amazing. And really, I've seen quite a few times with, Nemo Studio, how it can detect, where the major nerves and the major blood supply is. And, there's no more guesswork.
Mhm.
It's really pretty amazing, this software.
Yep.
Let's see if there are any more
Any other questions?
questions for us. Right now, no more questions, but I want to let everybody know what's happening on Zon Academy coming up in April. I mean, I can't believe we're here already. It's springtime, hooray. But starting April 1st, every Tuesday, we usually have our education on Wednesdays, but every Tuesday, we're adding exocad demonstration from getting started on the first week and being able to design a single crown if you're new to exocad, all the way through to complex all on X cases. So that will be every Tuesday for 5 consecutive weeks, 2 p.m. Eastern. And then we also have on April 2nd, Scaling Success with Milos Markovic, who's a CDT, and he talks about how his laboratory was, scaled some success by adding a new printer. And he's going to be speaking about Form Labs, the new Form BL, and how they use that at Aurora Technology Center. So that's going to be on April 2nd. We also have our April road show hitting the road. We're going to Arizona, and that's going to be on April 10th and 11th. We're heading to Mesa, Arizona. We're going to be talking about everything 3D printing to milling. This is going to be a mini trade show, road show, all, photogrammetry with Shining 3D, exocad training on the Thursday. And that's a half day course. So please join us. We're going to be hitting the road from now until November, a different city each month. And you'll be able to go to zondental.com and look under the education tab, and you'll be able to see the full lineup, all the dates of all the education we have coming up for the month of April and throughout the next 3 months of all of our road shows. But I really want to thank Phil. Thank you so much for
Oh, you're
joining us
welcome.
today with
Thanks for
your
having me on.
expertise on Nemostudio. We really appreciate your time, and please extend our thanks to Dr. O'Neill as well. I know he couldn't be here with us today, but we really
Absolutely.
appreciate him, taping his segment for us.
And my
So
number is on there too. If anybody has any kind of questions, they can contact me as well.
awesome. I thank you so much, and I hope everybody has a great day today, and we'll see you next week. And Zon Academy. Have a great day, all.
Take care.
Bye.